welcome. Very good morning. First of all, thank you, Kieren Bong, for the invitation to your beautiful city. And thank you everyone for taking the time on a Saturday morning, especially such a beautiful summer Saturday morning, to attend today's session. We have quite a packed session this morning and this afternoon, and I'll try to share with you my experiences as well as my techniques. The first two procedures are two of my most passionate procedures. The first one is 3D Ultimate Lift, and the second is 2.9 Lift. I constructed both these techniques about 5.5 to 6 years ago, specifically for Teoso Ultimate, but now for RHA, and then for Redensity 2 for infraorbital hollows. I would like you to keep this in mind before we start, that there are different types of fillers on the market. First of all, we have 250 brands of dermal fillers in Europe alone, and within each brand, we have different grades and different types of fillers. Why? Because all the different fillers have been formulated for different indications. And I would like you to think about your children. Each of your child has different behavior and personality, and it's the same with dermal fillers. Every type and grade of dermal filler comes with different behavior and personality. So if you want to do a procedure well with minimal amount of product, we need to understand the biochemical specification of the filler, and that allows us to understand the personality as well as the behavior of the filler. And when you understand the behavior and personality of the filler, you'll be able to predict the result even before you start. So I would like you to keep that in mind, because through the course of this morning and afternoon, I will talk a lot about why I picked that particular filler based on its biochemical specification. Okay? Right, let's get started. The first topic I'm going to talk about is the 3D Ultimate Lift. It was constructed about 5.5 years ago, specifically for ultimate. It is one of my most passionate procedures because I tend not to film the face. I tend not to correct an isolated part of the face, because if you think about it, when we age, the entire face ages. So it doesn't make sense that we zoom in to one part of the face and we try to correct that part of the face. That's not going to give us an overall holistic improvement for a natural result. So we have to always look at the entire face, and instead of filling, we sculpt and contour the face. So we have a lot to cover. Short session, I have 1 hour, 2 topics. I will need your attention, but very importantly, I need you to be able to imagine weight of it will accentuate the nasolabial folds even further. Then we have compartment number 2. Compartment number 2 is one that loses significant amount of volume. It is immediately under compartment number 5, which is the infraorbital fat part. So when this loses significant amount of volume, it increases the lip-cheek junction. Everything goes southward because of the presence of the retinacular cutis. It drags the skin down as the translocation of the fat happens. Consistent with the aging process. When we age, here loses significant amount of volume. So as part of your rejuvenation process, you want to account for this. Just filling that marionette line alone is unlikely going to give you the most natural result, which is why I usually tend to use a 3cc Teoso Ultimate, because that represents very good value for money. Now you might think 3cc is a lot of filler. It is not a lot of filler. It is a lot of filler if you're just doing the middle part of the face, but it is not a lot of filler when you're trying to rejuvenate the lower 1/3 of the face, because this can really take up a lot of volume. But in her case, I'm going to try to use very little product. I'm going to try to see if I can use 1cc of Teoso Ultimate here and 1cc here. to keep it cheap and cheerful. Okay, so it's a 23 gauge entry needle. Pinch the skin a little bit, no anesthetic required. 1, 2, and 3. Bevel up. This is not redensity 2, this is ultimate. We want to go nice and deep. There. Okay. One more time. Okay, so I'm 0.7 now. I'm very conscious of the fact that I don't have a lot of filler. Let's not do too much. I have done 0.4.
So the first filler was Ultimate?
The first product was 1 cc of Ultimate. The second product was 0.4 of Redensity 2. And let's give it a wipe. Okay, let's sit her forward and let's have a look. Okay. That's great. Okay, so can you see there is more contour, there is more lift, there is lifting of the lip cheek junction forward, and that's just with 1 cc of Kyoso Ultimate, 0.4 of Redensity 2. I'm going to move on to the other side now. Okay, does it look alright on camera?
Yes, we can see it's very good.
Okay, now let's go through it one more time.